Hi, my name is Eric Hedberg. In this video, I will be giving some basic information on acceptance and commitment therapy. I don't intend for the video to be a long video, and so I won't be able to go into great detail about the therapy. However, my goal is that by the end of the video, viewers will have enough information to decide if acceptance and commitment therapy is a subject that they would like to learn more about. I'm going to start off by talking just a little bit about how we refer to acceptance and commitment therapy. Unlike other therapeutic modalities like cognitive behavioral therapy, which is often referred to as CBT, and dialectical behavior therapy, which is often referred to as DBT, rather than saying ACT, practitioners of acceptance and commitment therapy prefer to refer to it as ACT. And there is a reason for this. One of the major components of acceptance and commitment therapy is taking committed action based on our values. And so therefore ACT is an appropriate way to refer to the therapy. ACT is part of a category of therapies called the third wave behavioral therapies. And these therapies tend to build on second wave behavioral therapies such as CBT or rational emotive behavior therapy. And third wave behavioral therapies often combine mindfulness and mindful acceptance with behavior interventions. I'll talk now just a little bit about the history of ACT. Stephen Hayes, who is credited with creating ACT, grew up, he was interested in Eastern philosophy and mindfulness, as well as a number of different therapeutic approaches, including Beck's cognitive therapy and Ellis's rational emotive behavior therapy. And as a young man, Hayes struggled with symptoms of panic disorder, and he attempted to use what he knew of cognitive therapy and rational emotive behavior therapy to address these symptoms. He started tracking the symptoms and applying those therapeutic techniques to try and reduce his symptoms. Ultimately, what he found was that focusing so much on the panic disorder actually increased the symptoms. And he eventually went back to his roots in Eastern philosophy and began applying mindfulness to the symptoms of the panic disorder in order to allow him to keep living a meaningful life. And so essentially this was the beginning of ACT. In the mid-1980s, Hayes worked with a group of colleagues to further develop those ideas into what is currently known as acceptance and commitment therapy. The first randomized clinical trials began in 1986. However, no book was published to fully describe ACT until 1999. And this was on purpose. Hayes has later said that he and his team felt that in the 1980s, ACT was not fully developed enough to withstand the test of time, and that essentially they felt the need to continue working and adding to ACT and developing the techniques behind it to make a very effective therapeutic approach. Currently, there are over 7,000 practitioners of ACT worldwide. So I'm going to talk just a little bit about some of the most important concepts of ACT, and those are mindful acceptance and value-driven action. ACT recognizes that there are a number of unpleasant and negative internal experiences involved in most mental health disorders. For instance, those may be very unpleasant thoughts and emotions that are tied to the mental health issues. And rather than trying to change or deny those experiences, ACT promotes use of mindful acceptance to essentially address those symptoms, accept them, and recognize the temporary nature of them, and then essentially refocus on taking committed action in our lives that is based on our values, based on what's important to us, and moving us towards important goals. ACT also talks about two concepts that tend to be harmful and impair life, um, and those are cognitive fusion and experiential avoidance. Cognitive fusion occurs when an individual becomes so caught up in their internal experience, in their thoughts, and their emotions, that it really becomes a source of identity for them, and they're unable to separate from those internal experiences. Negative thoughts often become absolute truths in life and really dominate the way that we're able to interact with the world. And that cognitive fusion can ultimately lead to experiential avoidance, which is essentially when, due to expected unpleasant internal experiences like thoughts and emotions, we avoid taking action that would benefit us. For instance, a depressed client may spend a large amount of time at home and isolate themselves due to expected negative internal experiences when they socialize with others. And we know, there's plenty of research suggesting that positive social interactions can be quite helpful in treating depression. So that is an action, socializing is an action that would be beneficial to a depressed client. However, those expected negative thoughts and emotions may cause a depressed patient to avoid that experience. I'll talk now about a couple of philosophies of psychology. The first is mechanism, and essentially mechanism views the mind as a machine that's made up of parts, and often people would see some of these parts as dysfunctional or broken. And so the goal of mechanism is to remove, repair, or replace any of the broken parts. For instance, in cognitive behavioral therapy, often thoughts are labeled as cognitive distortions, as dysfunctional or irrational thoughts that need to be identified and replaced. And in contrast to that, ACT is based on functional contextualism, which does not view any thoughts or emotions as inherently dysfunctional or bad, but rather recognizes that under certain circumstances, thoughts and emotions can be harmful and can impair life. For instance, when an individual is in a state of cognitive fusion with a negative emotion that leads to experiential avoidance, we wouldn't label the thought as dysfunctional or wrong, but in that instance, the cognitive fusion and experiential avoidance may impair their living a meaningful life. So based on functional contextualism, practitioners of ACT, rather than labeling thoughts as dysfunctional, will ask whether a thought is useful or functional in this context. So essentially, when a depressed client says that life is hopeless or that things will never get better, rather than trying to ask them to replace that thought with something better, we might ask how helpful that thought is to them in the current moment, trying to accomplish whatever they're trying to do, and teach them to use mindfulness and acceptance to kind of allow that thought to be without becoming so wrapped up in it that they are unable to act in their lives. Also, along the same vein of thought, practitioners of ACT prefer to refer to clients as being stuck rather than broken. Again, without trying to label thoughts as dysfunctional or clients as broken. Rather, we recognize that it is very easy for individuals to get to a point where they are caught up in their own thoughts and internal experience in a way that causes them to be stuck, to be unable to make progress and achieve growth in their lives. There are 6 main components of ACT. I've discussed a few of them to some extent already. The first is contacting the present moment. And this is essentially, to me, this seems like what we commonly think of when we talk about mindfulness. Essentially, it is um, being able to intentionally um, be present in the moment, pay attention to our experience, our sensations, our thoughts, our emotions in as we interact with the environment around us, um, and really focus on this moment rather than getting caught up in anxieties over the future or regret or guilt over events of the past. Defusion, as I mentioned before, is essentially the ability to take a step back from our thoughts and emotions, um, to be able to observe them and recognize them as essentially messages and information being relayed by our mind, rather than being absolute truths that we have to live by. Acceptance essentially involves opening ourselves up to all experiences in life, even though some of those experiences will be uncomfortable or painful. And by opening ourselves up to those experiences, it allows us to take action that may cause some discomfort, but will ultimately benefit our lives and lead to a more meaningful way of living. Self as a context is the term that ACT uses to talk about that part of ourselves that is able to take a step back and observe, and just observe our current experience. It recognizes that even though things change in our lives, our roles change throughout lives, sometimes our views and our beliefs change as we grow. However, there is a constant part of us that is able to step back and observe our thoughts, observe our experience, our sensations as we go through life. And the four components that I've described already, all of these components essentially are help promote that diffusion and that ability to tolerate some negative internal experiences, to be able to take committed action in our lives. And the final two concepts are more about that action itself. Values is essentially just becoming more aware of what is most important to us in life, what are the the goals that we want to achieve to live a meaningful life. And as we become more aware of those values, we want to take committed action. We want to examine our decisions and make sure when we take action that it is aligned with those values, and that it does lead to and promote healthy and meaningful living in our lives. This is just a visual representation of the 6 components of ACT. If you'll notice in the center, the diagram shows psychological flexibility, which is the ultimate goal of acceptance and commitment therapy. Essentially, by utilizing the 6 components of ACT, the goal is for individuals, when they are faced with some unpleasant experiences, to be able to be diffused, to tolerate some of that discomfort in order to keep their options open and be able to act in a way that will ultimately benefit them and lead to a healthy life. So in practice, ACT tends to rely a lot on metaphors as a way to convey information, rather than using a more traditional didactic approach of simply explaining concepts. Metaphors are very helpful in that they are able to convey a good amount of information in a relatively concise way. One of my favorite metaphors used in ACT is to refer to going through life as if we're climbing a mountain. And so essentially, along the way as we're climbing this mountain, there are going to be challenges that we face, perhaps some rocks have fallen into our path, or perhaps we have to scale a little bit of a cliff to continue to progress up this mountain. And as a practitioner of ACT, I might say to a client that you're over there climbing your mountain, and even though I'm a clinician, a therapist, I have my own mountain to climb. So I'm over here climbing, and from my perspective, I may be able to see some of the challenges that you are facing and help you to navigate them by offering a different perspective. And I like that metaphor for a number of reasons. I really appreciate that it emphasizes that even though we are working in a role as therapists to try and help our clients, that we are people as well, and we face our own challenges, just like anyone else. I think that the metaphor really helps to create an atmosphere of equality and a sense of working together with the client to face some of the challenges that they're experiencing. On top of metaphors, ACT often utilizes activities and experiential learning. So it's not necessarily a lot of talk all the time. ACT feels that activities really kind of help solidify some of the concepts that promote healthy living. Often mindfulness activities and techniques are taught, but along with that, some of the activities are essentially representations of metaphors that are used. For instance, one that I have seen used in ACT that I enjoy asks a client to hold a clipboard in front of their face. And this clipboard is representing all of those negative thoughts and emotions that sometimes get in the way of living. And to drive it home even more, you can actually write down on a piece of paper on the clipboard some of the very specific thoughts that the client is struggling with. And essentially, while they're holding the clipboard in front of their face, you would ask them what it's like trying to interact with you, trying to connect with you and have a good conversation, and how do those internal experiences really make it more challenging. Then, after a quick discussion of that, you can get the client to, essentially, if I hold my hands up, get the client to press the clipboard against my hands and try and push away the negative thoughts and experiences that they're having. Ask them, are they getting tired? Are their arms burning? What are the consequences of that, trying to push those negative experiences away? And again, how does that interfere with trying to connect to other people around them? And then finally, you ask the client to place the clipboard in their lap and explain to them that ACT does not get rid of all of those negative experiences and emotions. That's not the goal of ACT, but the goal is to, through the use of mindfulness and acceptance, to learn to not be so fused with those thoughts that we can just kind of set them in our lap. They're still there, we can still see them, they're still going to come up from time to time, but essentially we are able to acknowledge and accept them and still be able to connect with and interact with the other people around us. Well, that's all the information I have time for in this video. There are a number of wonderful references and sources of information about acceptance and commitment therapy, so I hope that anyone who is interested will take the time to go learn more.